Alright, so my name is Marissa and this is my video for the changing the dressing for a central line. So the first thing I'm going to do is I'm going to check my chart here. And my patient's name is Jennifer Doe, and I check her allergies right away, and she has no known drug allergies, but I'll double check that once I get into her room. I also look and see that she has an order that this is dressing change is to be done. So I'm going to go ahead and gather my supplies then. And the supplies I have is my central line dressing change kit here, tape measurer, some alcohol swabs, some sure prep, a mask for my patient, some tape, some hand sanitizer, and some gloves for myself. So before entering her room, I'm going to wash my hands. And then, knock, knock, knock. I'm going to provide for some privacy. And then, hello Jennifer, my name is Marissa. I'm a student nurse, and I'm going to be doing your central line dressing change today, if that's okay. And she says, yep. And I say, can you please tell me your name and date of birth? And she says, Jennifer Doe, 11/5/1975. And I have Jennifer Doe, 11/5/1975. So Jennifer, I have that you have no drug allergies listed. Is there anything that we don't know about, or any cleansing agents that you're allergic to for what we're going to be using for changing your dressing today? And she says, nope. And I say, okay. So then the next thing I'm going to do then is go ahead and open up my sterile field here. And I'm going to apply my mask. And then, Jennifer, since the procedure that we're doing, or the dressing change that we're doing, is supposed to have a sterile field, I'm going to ask you to wear a mask. Are you able to do so? And she says, yep. So I go ahead and I give Jennifer a mask. If she is not able to do so, I would just have her turn her face away from the side that I'm doing the dressing change on. But since she is able to, we have one on. So then I'm going to go ahead and I'm going to don some clean gloves. Alright, and then before doing anything with the dressing itself, I'm going to go ahead and I'm going to measure her arm circumference. And to do that, I'm going to go 6 inches above the insertion site. And then in centimeters, I am going to measure. And then for Jennifer, we're at about 25 centimeters there. So I'm going to check that with her baseline from when her central line was placed to make sure that it's still okay. All right, and then I can go ahead and I can remove her dressing here. Remove the tape. And then when I'm doing the dressing or the tegaderm itself, I'm going to be removing from the outside in towards the insertion site. This one's on there good. And then once I'm into the center there, I can go ahead and pull off. When I'm doing this, I'm going to be looking at her site itself to see if there's any redness, ecchymosis, edema, drainage, and the approximation. And since it's a PICC line, it should pretty well be approximated, and hers is. Also, I'm going to check on the dressing here, the tegaderm, and see if there is any drainage. And if the drainage, I'm going to note the color, if there's any odor, the consistency, and the amount of drainage that there is. But she is seems to be pretty good. When I'm doing this, I'm going to also be inspecting the line itself and the central line itself and make sure everything looks all right. And I'm also going to make sure that there's a secure device in place, which she has one. So then I'm going to go ahead. Oh, and before that, I'm going to palpate her arm. And Jennifer, are you having any tenderness at all? And she says no, and everything seems good. So then I'm going to go ahead and I'm going to remove my gloves. I'm going to wash my hands. Alrighty, and then I'm going to apply my sterile gloves. finger. All right, there we go. All right, once my sterile gloves are applied, I'm going to go ahead and I'm going to grab the cleansing solution thing here. Regularly, I would push this button to allow the solution to go into the sponge. And then I'm going to clean for 20 to 30 seconds, going back and forth, creating friction to clean anything. If there was any dry blood or anything on there, I could use an alcohol wipe to remove that as well. So once this is done, I would throw this away. And then I am going to apply some Sure Prep. So I take the Sure Prep, I would open this up, and I would apply on the radius, not on the site itself, just on the radius to where the tegaderm would be being placed. Throw that away, and then I am going to remove my sterile gloves, throw them away, wash my hands once again. I'm going to place clean gloves on. All right, and then I can go ahead and I can place my tegaderm on. So when putting her tegaderm on, I am not going to touch the inside of the tegaderm at all or anything where the sterile site will be. Go ahead and place it down. And then remove the outside border. All right, and then there's a sticker right on here, so I can use this sticker for a label, and I would put my name, date, time, well, I guess just my initials, not necessarily my name, and I would place that right onto the dressing. And then I will take some tape that they have provided here, and I will use that to hold the catheter for the central line in place a little more too at the end. Depending on agency protocol, this is when I would change the cap as well. And that's usually done during dressing changes. So then I can go ahead and I can remove my gloves, wash my hands, remove my mask, and then I can remove Jennifer's mask as well. All right, Jennifer, we are all done. So I'm going to take your mask here. Modification, lifespan modification would be if I was doing this on a child, maybe the parent would want to be present, so the parent would have to wear a mask as well to sit by the child. When I'm all done, I'm going to dispose of my supplies here, get rid of everything I'm done with. I am going to make sure my patient is safe, put the bed at the lowest spot, side rails, make sure she has her call light. Jennifer, is there anything else I can get for you? And she says, nope, everything's fine. And then before leaving the room, I would wash my hands, and then I would go and document, and I would document the placement, or the dressing change, and the date and the time, and how well Jennifer tolerated it.